Hello everyone, I am Dr. Ambanna Gowda, consultant physician and diabetologist at Sparsh Hospital, Bangalore. Today we'll have a discussion about blood pressure. Now, what do you mean by blood pressure? Blood pressure is something when the heart beats, it pumps the blood into the blood vessels, wherein the blood vessels exerts pressure on the walls. So that is called as blood pressure. Generally, everyone will have a rise and fall every day throughout the day in their daily activities of life. But there are certain conditions wherein the blood pressure persistently increases and remains high. This is called high blood pressure. Now, what are the reasons? What are the risk factors for having high blood pressure? In other words, called hypertension. Age, uh, as your age progresses, definitely you tend to have stiffening of the arteries and leading to high blood pressure. Excess salt intake can have lead to high blood pressures. Familial history of a known blood pressure in the family, someone definitely you need to be regularly checking because you'll end up having blood pressure. Smokers having long-standing smoking will have blood pressures. So these are the various reasons where risk factors, where some of the medications like for females, oral contraceptive pills, other medications, hormonal replacement therapy, these are the people who will having risk factors to develop an hypertension. Now, hypertension in other words is called a silent killer. Why? Because there are no specific signs and symptoms and the event occurs unannounced. So, generally, faint lightheadedness, faintness, giddiness, palpitations, decreased sleep, these are all the signs which we see, symptoms which we can see in an early hypertension. So generally, now how to deal with the hypertension, how to diagnose with the hypertension. If you are having risk factors as we discussed and your age is above 40, everything, regularly you need to get your blood pressure checked. Even though if it is varying a lot, sometimes visiting hospital can raise your blood pressure. It is called white coat hypertension. So such scenarios to not to undermine and find the exact reason for hypertension and to diagnose hypertension, there are various modalities, and one of them is ambulatory BP measurement also, which lately over the few years we have been using, wherein we monitor your blood pressure throughout the day, wherein you will wear a device throughout your normal activity, and at the end of the 24 hours we analyze your blood pressure readings. Now, these are the various modalities how to diagnose your hypertension. Now, how to take care of hypertension? Hypertension generally can be controlled prior to going to medications. That is, normal blood pressure is 120 by 80, but as the number of age varies, so it varies person to person, decade to decade. So normally if it is less than 140/90, you're supposed to be having normal blood pressure. So generally how to control blood pressure now? Having a good lifestyle, wherein good amount of exercise, daily walk, brisk walking, quitting your smoking, and reducing your salt intake. Daily requirement is around 2300 grams, so you are having more than 1 teaspoon, in other words, can over a period of time give rise to hypertension. So reduce your salt intake, then uh, stop your alcohol intakes, and regular blood pressure monitoring is also important. So one of the dietary aspect is something called as diet associated stop hypertension. And this is a program wherein the various kinds of diets are advised, wherein generally low saturated fat, Mediterranean diet, low salt in your daily intake, as in salt consumption is not that added salt what you use it in your daily life. It is about processed food, canned food, uh, and pickles, sometimes like papads. So these are all require a lot of amount of preservatives. Like Chinese food, it contains monosaturated sodium salt. Sodium monoglucate. These are the things where more preservatives are there and more salt content the food is. So you have to read your food labels, decrease your salt intake accordingly, then quit smoking, reduce your alcohol intake, and have a good sleep. Minimum of 8 hours is all what is required to control hypertension. Now, apart from this, having to reduce your stress. Stress is main factor where in day-to-day life, if you know how to manage it, you can reduce your blood pressure accordingly. So can have your hobbies, singing, dancing, or practicing yoga day to day, having brisk walks, meditation is one of the aspect of reducing stress. So these are the factors wherein you can collectively reduce your stress and your hypertension per se. So at the end, I would like to come to important aspect of hypertension is adherence to medications, wherein you are diagnosed with a diabetes, hypertension, and you need to be on continuous adherence to medications. If you tend to skip your medications, there will be fluctuations in blood pressure, which can give rise to cardiac events and cerebrovascular events, as in stroke to the brain and stroke to the heart. So ideally, regular follow-up is required, regular medication intake is required, and I'm maintaining a healthy lifestyle. Everyone definitely at the end of the day would like to have a healthy and fitter lifestyle. So ideally, following all these guidelines and into your daily activities in your lifestyle can give you a healthy life and a healthy future ahead. Thank you.